As we age, the human body undergoes countless changes. Metabolism slows down, digestion becomes weaker, the cardiovascular and skeletal systems lose strength, while the risks of chronic illnesses such as diabetes, hypertension, heart disease, and even memory decline increase. That is why nutrition plays a critical role in maintaining health, preventing disease, and prolonging life expectancy for seniors. A study by the World Health Organization who revealed that an unhealthy diet is the leading cause of over 60% of chronic diseases in older adults. In other words, simply by adjusting eating habits, seniors can dramatically improve their quality of life. However, in daily meals, many foods that seem familiar and harmless actually pose hidden dangers for the elderly. Some raise blood pressure, some increase cholesterol, others affect memory, sleep, and even shorten lifespan. In today's video, as a nutrition specialist, I will analyze in detail 5 types of foods that are harmful to seniors' health. These are not myths or hearsay. They are backed by solid scientific evidence and medical research. Limiting or avoiding them in the diet will help older adults live healthier, stronger, and longer. 1. High-sodium foods. The silent enemy of the heart salt, or sodium chloride, is a familiar seasoning in every meal. But few people realize that seniors are among the most vulnerable groups when it comes to excess salt intake. According to WHO recommendations, an adult should consume no more than 5 grams of salt per day. However, dietary surveys in Vietnam reveal that the average daily intake is 2 to 3 times higher than this threshold. This means most elderly people are already at increased risk of hypertension and cardiovascular complications. The consequences of excessive sodium include hypertension. Sodium retains water in the body, increasing blood volume and putting pressure on blood vessels. Heart failure and stroke. Prolonged high blood pressure is the leading cause of heart failure and cerebrovascular accidents. Kidney damage. Aging kidneys already function less efficiently, and excess sodium accelerates their decline. A Japanese study published in the Journal of Hypertension in 2019 reported that older adults consuming more than 10 grams of salt daily had a 23% higher risk of stroke than those who consumed less. Foods high in salt include pickles, fermented vegetables, fish sauce, soy sauce, canned goods, sausages, instant noodles, and richly seasoned stews. For seniors, reducing salt in cooking and replacing it with natural herbs and spices like garlic, ginger, lemon, or green onions is a much healthier choice. 2. High sugar foods. Sweet but dangerous sugar brings a pleasant sweetness that makes meals more enjoyable. Yet for seniors, excess sugar is nothing less than a hidden poison. The American Heart Association, AHA, recommends limiting added sugar intake to no more than 25 grams per day for women and 36 grams per day for men. But sugary foods are everywhere. Candies, cakes, sodas, condensed milk, sweetbreads, and more, making it easy to exceed safe limits without noticing. The harms of sugar for older adults include increased risk of type 2 diabetes. The elderly body often produces less insulin, so consuming sugar leads to spikes in blood glucose, obesity, and visceral fat. Excess sugar is converted into fat stored around the abdomen, a key driver of cardiovascular disease and stroke. Memory decline. A University of California study found that high-sugar diets are linked to impaired cognitive function in older adults. Accelerated aging. Sugar contributes to glycation, damaging collagen, leading to wrinkled skin and weaker joints. The National Institute of Nutrition in Vietnam reported in 2021 that over 40% of seniors are at high risk of metabolic syndrome due to excessive sugar and refined starch consumption, instead of sweet desserts and sugary drinks. Seniors should opt for low-sugar fruits, such as apples, grapefruit, cucumbers, or nuts, which provide energy while reducing health risks. 3. Fried and greasy foods. A burden on the heart and digestion. Golden, crispy fried foods are tempting, but for seniors they are among the most harmful choices. When oils are heated at high temperatures, especially reused oils, fatty acids oxidize, producing free radicals harmful to cells. Fried foods are also high in saturated fat and trans fat, both well-established contributors to atherosclerosis. Key dangers: raises LDL bad cholesterol and lowers HDL good cholesterol, gives increasing heart disease risk. Difficult to digest, gives older adults weaker digestive systems, struggle with heavy oils. Cancer risk, gives acrylamide, a potential carcinogen, forms during frying. A Harvard study found that people who ate fried foods 4 times per week or more had an 8% higher risk of premature death compared with those eating fried foods less than once per week. Healthier cooking methods for seniors include steaming, boiling, light braising, or baking at low temperatures, while using vegetable oils like olive oil or canola instead of animal fats. 4. Red meat and organ meats. Excess cholesterol and purines. Red meats such as beef, lamb, and pork, along with organ meats like liver, kidneys, and intestines, are rich in protein and iron. However, for seniors, excessive consumption does more harm than good. Scientific evidence shows red meat contains high levels of saturated fats, gives raising cholesterol levels. Organ meats are high in purines, gives leading to uric acid buildup and gout. Colorectal cancer risk. The International Agency for Research on Cancer, IARC, classified red meat as probably carcinogenic to humans group 2A. A 2012 report in the British Medical Journal concluded that daily red meat eaters had an 18% higher risk of death from cardiovascular disease and a 10% higher risk of cancer mortality compared to low consumers. Seniors should still consume protein but shift toward white meats like chicken and fish, or plant-based proteins such as tofu and soy, which are easier to digest and healthier for the heart and kidneys. 5. Alcohol, beer, and stimulants. Silent destroyers. Some believe that a glass of wine or beer aids digestion, but for seniors, alcohol and stimulants pose far greater risks than benefits. Main harms: liver and kidneys. Aging livers metabolize alcohol less effectively, increasing risks of cirrhosis and liver failure. Nervous system. Alcohol disrupts sleep, worsens memory, and contributes to dementia. Bone health. Alcohol interferes with calcium absorption, raising osteoporosis risk. Accidents and falls. Alcohol impairs balance and reflexes, especially dangerous for the elderly. According to the U.S. Centers for Disease Control and Prevention, CDC, over 10% of hospital admissions among people aged 65 and older are alcohol-related. Other stimulants like strong coffee or concentrated tea can also cause rapid heartbeat and insomnia. Seniors should stick to light green tea or diluted coffee in moderation and absolutely avoid overconsumption. From these 5 groups of foods, it is clear that poor dietary choices significantly worsen health outcomes in seniors. To stay healthy, older adults should follow these key principles. Reduce salt, sugar, and fried or oily foods. Increase intake of vegetables, fruits, and whole grains. Prioritize fish, poultry, and plant-based proteins over red meat. Stay hydrated, limit alcohol and stimulants. Eat smaller, more frequent meals, chew slowly to aid digestion. Alongside nutrition, light daily exercise such as walking, tai chi, or yoga, combined with a positive mindset, forms the golden key to longevity and vitality in later years. If you found the information in this video helpful, please like and share it so that more families can benefit. Don't forget to subscribe to our channel for more science-based nutrition advice and health tips for seniors. We are committed to bringing you accurate, practical, and easy-to-follow guidance to support healthier and happier golden years.